Welcome to ATCM, the Emergency Medicine channel. Today, we are going to discuss the drug Amiodarone. In this module, we are going to discuss the classification, the mechanism of action, the dilutions, the dosing, the metabolism, the indications and the contraindications, and finally, the complications and side effects of Amiodarone. First, we come to the classification of Amiodarone. Amiodarone is a benzofuran that comes under the class 3 antiarrhythmic drug in the Vaughan Williams classification. It is structurally similar to thyroxine and procainamide. So, Amiodarone belongs to the class 3 antiarrhythmic drug of the Vaughan Williams classification. Now we come to the mechanism of action of Amiodarone. Coming to the mechanism of action of Amiodarone, the primary mechanism of action of Amiodarone is the sodium channel blocking property. Thus, it prolongs the refractory period and the action potential. Whereas, it also has some secondary actions, that is, it blocks the calcium channel, the beta blocker and the sodium channels. Thus, it decreases the rate of depolarization and also decreases the heart rate. So, coming to the primary action of Amiodarone, that is the sodium channel blocking property, whereas it has some added secondary actions, that is the calcium channel, the beta blocking and the sodium channel blocking property. Now we come to the metabolism of Amiodarone. Amiodarone is a lipid soluble molecule. It is largely metabolized in the liver and it has a large volume of distribution. Now we come to the route of drug administration. Amiodarone is available in oral form as well as in IV form. So, it is ideally given either through the oral route or in emergency conditions through the IV route. Now we come to the indications and contraindications of Amiodarone. Coming to the indications of Amiodarone, it is used in all stable tachyarrhythmias, especially the atrial tachyarrhythmias and the stable VTs. It is then also used in cardiac arrest if it is showing a shockable rhythm. So, two important conditions where we administer Amiodarone is stable tachyarrhythmias and also in cardiac arrest if it's a shockable rhythm. Now we come to the contraindications of Amiodarone. If the patient is having any hypersensitivity to Amiodarone, if the patient is having severe hypotension, severe bradycardia, severe heart blocks, these are all the important contraindications of Amiodarone. Since we have learned the Amiodarone is largely metabolized in the liver, if the patient is having a severe liver impairment, it is also a relative contraindication of Amiodarone. So, if the patient is having hypersensitivity, heart blocks, bradycardia, sinus dysfunctions, hypotension, liver impairment, these are all the contraindications of Amiodarone. Now we come to the dosing of Amiodarone. the dosing of amiodarone in cardiac arrest and also in the case of tachyarrhythmias. In cardiac arrest, we will give amiodarone 300 mg as IV bolus followed by 150 mg if it is needed. Whereas in the case of tachyarrhythmias, we will give 150 mg of amiodarone, which is given over a period of 10 minutes followed by 1 mg per minute of amiodarone over 6 hours followed by 0.5 mg per minute of amiodarone over 18 hours. So, in the case of stable tachyarrhythmias, we will give 150 mg of amiodarone over 10 to 30 minutes followed by 1 mg per minute over 6 hours followed by 0.5 mg per minute over 18 hours. Now we come to the drug and dilution of amiodarone. So, 1 ampule of amiodarone contains 3 ml, which is equal to 150 mg. Therefore, 1 ampule contains 3 ml, that is equivalent to 150 mg. Come to the stable tachyarrhythmias. Here we will take 1 ampule, that is 3 ml, that is mixed in 47 ml of 5% dextrose, and then it is given over 10 minutes. Followed by, we will take 6 ampules, which corresponds to 18 ml, and that is mixed with 450 ml of 5% dextrose, and we will give at a rate of 15 ml per hour over 6 hours followed by 30 ml per hour over 18 hours. So, this is the dilution and dosing of amiodarone. So, 1 ampule is equal to 3 ml, that corresponds to 150 mg. So, initially in the case of stable tachyarrhythmias, we will take 1 ampule, that is 3 ml, that is mixed in 47 ml of 5% dextrose, and it is given over a period of 10 to 30 minutes, followed by 6 ampules, that is 18 ml, that is mixed in 450 ml of 5% dextrose, and it is given at a rate of 1 mg per minute, which is equivalent to 15 ml per hour over 6 hours, followed by 0.5 mg per minute, that is 30 ml per hour over 18 hours. Now we come to the complications and side effects of amiodarone. Coming to the complications of amiodarone. The complications in the CVS, it can cause bradycardia, it can cause hypotension, and also it can increase the QTc interval, thus can lead to torsades de pointes. Then its side effects in the respiratory system. Amiodarone can cause pulmonary fibrosis and hypersensitive pneumonitis in the respiratory system. Coming to the CNS, it can cause tremors, ataxia, etc. Then we come to the skin. It can cause photosensitivity of the skin. Coming to the eyes, it can cause corneal deposits inside the eyes. And finally, coming to the thyroid, as I told earlier, it is structurally similar to thyroxine, therefore, it can cause both hypo and hypothyroidism. Also, it can also cause worsening of the liver status as it is metabolized in the liver. So, coming to the complications in the CNS, it can cause ataxia, it can cause tremors, respiratory system, pulmonary fibrosis, pneumonitis, and CVS, it can cause severe bradycardia, hypotension, and torsades de pointis. Coming to the skin, it can cause photosensitivity, and the eyes, corneal deposits, and thyroid, both hypo and hypothyroidism, and it also causes liver impairment in the case as it is metabolized in the liver. So, in this module we have discussed the classification, the mechanism of action, the metabolism, the routes of administration, the indications, contraindications, the drug dilution and its dosing, and finally the complications and side effects of amiodarone. Thank you.